Hi, Dr. Noelle Lucas from Blue Oasis Pet Hospital here to answer some more questions about cat anesthesia, especially since this is a big topic. I've got an assistant to ask me some of those questions that you might have.
Dr. Lucas, what kind of anesthesia is used usually for cats?
So the most common types of general anesthesia used for cats, so there's the injectable types of anesthesia. So one of the drugs that we'll use is often ketamine. We'll also use another medication called alfaxalone. Those would be dissociative, so they dissociate the conscious mind. And then to keep those, so those are injectables, but oftentimes we'll partner that with gas anesthesia. So the most common type used in veterinary medicine is isoflurane. But some hospitals also use one called sevoflurane. So both are just types of gas anesthetics that are used to keep your pet under general anesthesia.
What are common anesthetic procedures for cats?
So the most common general anesthesia procedures that we use at our hospital for cats would be coming in for a complete oral health assessment and treatment. So a dental cleaning and treatment. That cat's going to be under general anesthesia for that procedure. And then you guys all know usually for spaying or neutering cats, those would be the most types of common problems common things we would have your cat under general anesthesia for. But that's not limited to just those things. Some other things would be an intense wound care. Maybe there's your cat's had an unfortunate hit by car injury, or maybe a dog bite injury. So some type of real life-threatening injury or wound. We're going to use often general anesthesia for that as well.
What's the difference between anesthesia, sedation, and general anesthesia?
So anesthesia is taking your cat from consciousness to unconsciousness in a controlled way. And often we're going to intubate them with an endotracheal tube so we can control the depth of anesthesia and the duration of time we need them to be under. Sedation is for a shorter period of time, and it's for we often will use it for diagnostic imaging, so like maybe for x-rays, maybe for a quick wound repair that we can just keep them under a light sedation. Sedation means that cats immobilize, so they're not really moving, but they still have reflexes. They are still able to have some consciousness. They just really can't really control their body, or they don't really care to, because we've given them some medications so that they don't care. So that's usually what we do between anesthesia. General anesthesia is where we intubate them and keep them on a machine that will help keep them under for a long period of time, and sedation is for a more limited period of time and not unconscious.
Will my cat need lab work before anesthesia?
So yeah, we at Blue Oasis Pet Hospital do require blood work to be ran on pretty much all of our pets at some period of time during their either general annual visits, or if we're going to put them under general anesthesia. Blood work is always a great idea because we don't know what's always going on with the core organ function. So blood work will help us see if your pet has any underlying organ issues that we need to know about, either to stop us from moving forward with the procedure and diagnosing something new, or just making sure that they're just healthy to go under general anesthesia.
How can I prepare my cat for anesthesia?
So preparing your cat for anesthesia really starts at home. So oftentimes, if we know your pet's coming in for a dental cleaning procedure or a surgery like a neuter or a spay, we're often going to prescribe that pet we call it a calming pack, or it's just some medications or therapeutics to take at home before they even come into our hospital for anesthesia. So we are often calling you maybe a week before the procedure and saying, hey, come in, we want you to get these medications to have your pet take before anesthesia. Or if we know we schedule it while you're here, we're going to send that home with you. It's actually the same thing that they do for us when we go under anesthesia, is oftentimes there's a nurse that's going to call us and they're going to maybe prescribe some calming therapy for us so that when we come in for surgery, we're already more relaxed and it takes less drugs and it's just a more gentle sort of going into anesthesia and also coming out into recovery. It just helps make that a more gentler process.
How do you monitor for safety on an anesthetized cat?
Yeah, so safety is really important when your cat is under general anesthesia. We're going to do several things to make sure your cat is monitored very carefully. So we always have the doctor who's overseeing the case usually is usually in the vicinity of the patient during the anesthetic time. We also have a dedicated nurse who's trained. We do use licensed veterinary technicians here at Blue Oasis that are they're career professionals that are trained and educated in monitoring your cat under anesthesia. We're going to also partner that with monitors, so that's going to be like ECG, so we're going to watch the heart rhythm, we're going to watch blood pressure, we're going to watch oxygen levels, we're going to watch breathing, we're going to monitor temperature. So these are all things that we're going to be very, very proactive in doing to maintain good safety for your cat under anesthesia.
So how long does anesthesia last for a cat?
So anesthesia depends on the time or the duration of anesthesia really depends on what we are needing to accomplish for that cat. So a dental procedure may end up being 2 to 3 hours of general anesthesia, where a neuter, that little cat may be only under anesthesia for 10 minutes. So the length of time of anesthesia really depends on the procedure that we're performing on that pet. And as long as we're doing good monitoring and we have good stable vitals, we can keep those cats under as long as we need to take care of them. And if you have any questions about cat anesthesia or want to just have a really good candid conversation, we invite you to reach out to Blue Oasis Pet Hospital or your veterinarian to ask those questions.